Exciting time of year, nicer weather, kids getting out of school, time to head out to summer camp, summer vacations. I don't want to be the buzzkill here, but there is something that Idahoans should have on their radar. Maybe you got a message like this one from your healthcare provider. Take a look. A little pop-up reminder in my chart. Getting a vaccine from the measles is a good idea because just in the last several weeks, 3 Americans have died of measles, 2 kids and an adult. Those were in the states of Texas and New Mexico. And traveling from Idaho to places with outbreaks, more than 30 states at this point, it carries a risk that Idahoans will bring it back with them during this high volume travel season. And health leaders in Idaho are making a strong push to avoid that. The Gem State, unfortunately, has left the door open for an outbreak. Things have changed in recent years. There was a time in America that measles was just part of life. Hundreds of thousands, including many children, got the disease, and thousands died. But a campaign to stop measles kicked into high gear with the creation of a vaccine in 1963. Slowly but surely, case numbers went from hundreds of thousands in the 1960s to less than 500 in 1996.
In 2000, CDC declared that measles wasn't circulating in the United States anymore, so we had eliminated measles from this country. We continue to have cases every year. These were travelers coming back who had maybe gotten exposed overseas. But 2024 and 2025 are starting to feel different.
Dr. Christine Hahn is the medical director of Idaho's Division of Public Health and the state epidemiologist. Measles is back on her radar, concerning trends across the West.
So we're seeing outbreaks, more and more outbreaks than we've seen before. We think that's a combination. People are getting back to travel after COVID. And immunization rates have dropped, and fewer people are immune nowadays. So that when somebody does get measles, they're more likely to spread it to other people.
An outbreak in Texas led to the first American pediatric measles death in 22 years. Thousands of people have been infected across 31 states. Not in Idaho, but there is a data point that is concerning for Idaho in the conversation.
Measles vaccination rates were doing pretty well until about 2019, 2020, when COVID started hitting. In 2020, we saw a drop.
CDC data shows that Idaho has a declining vaccination rate for measles and a growing trend of vaccine exemptions for kindergartners. 2024 data has Idaho at essentially the lowest vaccination rate in the country for measles. Percentage-wise, 79.6%.
It's discouraging because it was so exciting to feel like we had eliminated measles, and measles is such a serious disease. It's discouraging to see the disease coming back. I understand people haven't seen measles. They haven't experienced it. But I'm hoping that as people educate themselves about the disease, they hear the reports from Texas and elsewhere about kids in the hospital or kids dying, that they take the time to learn about it.
Education is key in this conversation because an idea still floats out there that the measles vaccine causes autism.
That has been debunked. There have been lots of studies since then showing that that's not true, but there was a little bit of a hesitancy around that vaccine already. Then with COVID, I think people just became more concerned about vaccine safety in general, started questioning the childhood vaccines they were getting, so I think we saw another drop-off around that time.
So in the public health conversation, this is a prime example of the COVID backlash. And the concern in the coming months is people will travel to areas impacted by measles, bring it back to their communities in Idaho with low vaccination rates. And it's not a what if. This happened in 2023 across southwest Idaho. A person brought measles back from a trip to Europe, and it's highly contagious. That's one of the big problems. And I know someone watching this will say, well, people will get measles and they will be fine. And that's true. Plenty of people will, but it's hard to know who will do fine and who will end up in the hospital or who could possibly die. Just this year, 2025, 13% of American cases of the measles resulted in hospital stays. So the information you need to know: when kids turn 1, they are eligible for their first dose of the measles vaccine. It's the MMR vaccine. They can get the second dose at about age 5, heading into kindergarten. Adults, you can go get the vaccine, no problem. Even if you already had it or maybe you don't remember, there's no risk of being over-vaccinated for MMR.